Nerve tract technique is a system that treats nerve tracts through reflex points on the body. I developed it to release deep-seated neurological problems that cannot be treated in any other way. Each reflex point is associated with a different nerve tract, and we test them using applied kinesiology and this hand mode. The hand modes work in conjunction with muscle testing to determine the nature of the problem. They work as a shorthand communication tool with the patient's body to give immediate feedback to the doctor. Now I'd like to demonstrate the correct procedure for muscle testing. First, find a strong indicator muscle. The most convenient one is the pectoralis major clavicular. This chest muscle helps bend and turn the arm at the shoulder. Have the patient hold their arm straight out, level with the shoulder, palm out and thumb pointed towards the feet. These are the steps for the nerve tract technique. First, find a strong indicator muscle. You'll use this to muscle test the nerve tract reflex points. Now make a hand mode like an OK sign, touching the first phalanx to the second phalanx. Next, you'll test your patient by touching your fingers in the hand mode position to specific points and muscle testing the arm. Test medial and lateral to the nipple line on both the right and left sides of the chest. When you find an active point, the arm will appear weak. Have the patient touch this point with one finger. Finally, retest the nerve tract point. It should test strong. You can order a double activator from Victor Frank, care of Total Body Modification. Nerve tract technique was developed to release very deep-seated neurological problems that can only be corrected in this manner. Most nerve tract body points are located on the anterior ribs. If you palpate them, they will produce exquisite pain. They can also be therapy localized. The nerve tract technique adjustment sequence. There are 18 nerve tract test points in all, occurring on the front and the back of the body. The first 10 test points are on or between the ribs on the front of the body. The first nerve tract is the corticospinal. This controls distal extremity motor movement. The test point is between the 6th and 7th rib, lateral to the nipple line, on the left side of the body. The 7th tract is the parieto-temporopontine. This connects sensory information with auditory and olfactory centers. That is, spatial awareness. The test point is located on the 5th rib, lateral to the nipple line. The 14th tract is the spinothalamic tract. This carries pain and temperature information. The test point for the spinothalamic tract is located on the 1st rib, medial to the nipple line. The test points for the last 4 nerve tracts are on the front of the body. The way to test for them and find out if any are present is to make a hand mode which looks like an OK sign. Bring your thumb and next finger together. First, you test for a strong indicator muscle. Resist. Then bring these fingers together and test. Resist. We're testing the lateral and medial aspect of the chest. Lateral to the nipple line, medial to the nipple line. And resist, and that goes weak as well. Let's try the right side. Resist and resist. Nothing's showing up on this side. Then we go down and find the actual points. Resist, resist. There's a point right there. We use the double activator and adjust in 3 phases of respiration. That means inhale, middle of inhale, middle of exhale, and neutral breath. Keep your hand there, hold your arm up, resist, okay, and that should feel better there, right? Mm-hmm. Good. A little bit, yeah. Sometimes the only way to release the pain completely is to place the patient in different body postures and then adjust in that body posture, and then you can get the release. So hold your arm up, please. Hold, hold. Bend forward, hold. Okay, so this is showing up in flexion. One of the nice things about nerve tract technique is we can assist the digestive tract in functioning better. So I'm going to test here the gallbladder point. Resist, goes weak. Then we test the ileocecal valve. Resist, that's also weak. Now we'll test this point right here. Take a deep breath in, let it out. Take a deep breath in, let it out. Okay, keep your hand there and bend forward and resist. Now twist to the right. Resist, good. Now let's retest the gallbladder point. Resist and ileocecal valve, resist. So that fixed the ileocecal valve and the gallbladder. How'd that feel?
Great.
Yeah?
I just felt this movement.
Yeah?
Yeah, it was really nice. I don't feel so tense.
Good.
Thank you.
You're welcome.
I loved it.
Some patients, this is the only way you can get them out of pain. I had a patient once who came in to see me, and he had a bad night's sleep and was all bent out of shape and had a lot of pain, and he was in excruciating pain. And we did this adjustment, and he got out of pain so quickly that we both went for a run afterwards. So this definitely works. Thank you.